I feel like my chin is weak and recessed when I look at my profile. How much filler does chin augmentation typically require, and can it really compete with an implant? Chin filler augmentation produces remarkable profile improvement for patients with mild to moderate chin recession. A weak or recessed chin typically means insufficient anterior projection. When you view your profile, the chin falls behind an imaginary vertical line drawn downward from the lower lip. This recession affects your entire facial balance proportionally. It can make an average nose appear disproportionately large, emphasize a segmental fullness, which is the same thing as double chin, even in thin patients, and contribute to premature neck laxity. At Glow by Elena Reitman MD, I measured chin projection objectively using the Ricketts E-line, which is an imaginary line drawn from the nasal tip to the chin's most projecting point. The lower lip should fall approximately 2 millimeters behind this line in an ideally balanced profile. This provides a quantitative measurement rather than relying on subjective visual assessment. Filler volumes for chin augmentation typically range from 1 to 2 syringes depending on the degree of correction desired and your starting anatomy. I use firm, highly cohesive products such as Cresskill lip that resist compressive forces from the mentalis muscle and maintain forward projection without spreading laterally. Injection technique involves deep periosteal placement using a needle for anterior projection and a cannula for lateral blending along the mandibular border. The goal is forward projection that enhances your profile without creating an artificially pointy appearance. Filler advantages over surgical implants: no general anesthesia, no incision, immediately reversible with hyaluronidase, and incrementally adjustable over session. If you're unhappy with any aspect, this solution restores your original anatomy within 24 hours. Implant advantages would be permanent results, no maintenance, appointments, and capability for greater augmentation than filler can structurally support. For patients wanting more than approximately 3 syringes of projection, I recommend surgical consultation. Beyond that, volume filler becomes less cost-effective and less structurally reliable than an implant. Recognizing the boundary is part of responsible practice.